Hello everyone, today we'll be studying about the theories of the retention. So the mnemonics for it is Rio said bye after he saw his girlfriend's ad. Rio said bye after he saw his girlfriend's ad. Okay, so R for return. The teeth that has been moved tend to return to their formal position. There now seems to be the general agreement that the teeth tend to go back to their original position after the orthodontic tooth movement. The causes for the relapse are many and a single etiology cannot be highlighted. Now E. E for elimination. The elimination of the cause of the malocclusion will prevent the relapse. The cause for the malocclusion should be identified at the time of diagnosis and adequate steps should be formulated in the treatment plan to eliminate it. Failure to remove the cause increases the relapse potential. This theorem can only be applied in the cases of the malocclusion where the cause is obvious, such as thumb sucking, tongue thrusting, etc. And not in the malocclusions where the cause is elusive. Now third is O. O for overcorrected. Malocclusion should be overcorrected as a safety factor. Many orthodontists recommend the overcorrection so as to give leeway for a certain amount of the relapse. This has been practiced in treating certain conditions such as rotation, treatment of the class 2, class 3 malocclusions. Now, theorem 4 is again O. O means proper occlusion. Proper occlusion is a potent factor in holding the teeth in certain corrected position. Post-treatment stability is increased by good occlusion. The orthodontist should not restrict the treatment to achieving a good intercuspation when the jaws are closed, but should aim further at a good functional occlusion, that is, harmonious occlusal contact during the functional movement of the jaw. Now theorem 5. Theorem 5 is B. So B for bone and adjacent tissue must be allowed time to reorganize around the newly positioned teeth. When the teeth are moved orthodontically, numerous changes occur in the bone and the surrounding tissue. It takes considerable time for the reorganization to be completed. The new osteoid bone formation around the recently moved teeth offers the inadequate retention. Similarly, the periodontal as well as the gingival fibers take time to reorganize. Now, the theorem 6 is from I. I for the lower incisors. The lower incisors are placed upright over the basal bone. They are more likely to remain in the good alignment. The orthodontist should aim in positioning the lower incisors perpendicular to the mandibular plane or even retrocline. Now, theorem 7 is from G. G. The corrections carried out during the period of the growth are less likely to relapse. The orthodontic therapy should be initiated at the earliest possible age. It prevents the full-fledged malocclusion and compensation of both the dental and the skeletal from occurring. Now, next is theorem 8, which means F. G. F. The farther the teeth has been moved, the lesser is the risk of relapse. The farther a tooth has been moved, the lesser is the risk of returning to their original position. Now, theorem 9, which means add A. A means arc form, particularly in the mandibular arc, cannot be permanently altered by the appliance therapy. According to Macaulay, the mandibular intercanine and intermolar widths are uncompromising. Thus, they should be considered as the fixed landmarks and the rest of the arc built around them. Now, theorem 10. A. D. Add. D for devices. Many treatment malocclusions require the permanent retaining devices. This theorem was subsequently added by Moyers. The certain malocclusions might require the patient to be fitted with a permanent retaining device. This is true in the cases that have not been treated to achieve the occlusal goals that stand for the stability.